Good day, everyone. Once again, it's Nurse Lynn for Christy, and today I'm going to show you on how to interact to a real patient and how to conduct a physical assessment. So here is my patient. So, ma'am, good day. So I'm going to ask you a personal questions for us to have a insight about your personal information. So, what is your given name?
Maria Gia Marie R. David
Your middle name is
Rodriguez.
Rodrigo. Your family name is David, right? Gender is a transgender. Sure. So your birth date is when?
June 29, 1996.
June 29, 1996. So your address is
8676 Fortuna
Tunas.
Street, Olympia, Makati City.
Is it the postal code is 1207?
Yes.
Of course, the country is Philippines and the state or the province is CR. What is your phone number, Miss Gia?
0975
Okay,
412
okay.
5670.
So do you have any relatives here in the hospital?
Yes.
What is your relationship with him or her? Is Do you have any family members that is it the doctor?
Yes.
What is her name?
Victoria.
Ah, is she your aunt? So please check if the information is correct so that I can pass it already.
Yes, it's correct. Got it right.
So for now, Miss Gia, I'm going to ask you a personal question. And as of my latest observation, you have an edema in your left foot. So I will show it to the camera for them to see and to provide an evidence that you are having an edema on your left foot. So about your family health history, do you have diabetes?
Yes.
Um, Do you have any genetic um problems in your or genetic illness in your family?
Other than that, none.
Do you have do you experience difficulty of breathing?
Yes. Sometimes.
Sometimes when is it when you do exercise or when it's just a normal day and yet you're experiencing it?
Even it's just a normal day.
Okay. So I'm going to put it here in your background. So family, okay. Condition. So for my general action, I will start the visit, of course, to Gia. At first, Gia will going to capture your vital signs. So your height, Gia, is 178 centimeter, and your weight is um, 75 kilograms upon the weighing scale. So Gia, your BMI is 23.7, which is normal. Your temperature. So when you put this on your axilla, sure. So it is 35.7. So I'm going to get your blood pressure, Gia, and together with it, I'm going to use my 2 minute technique for me to be convenient and also get the pulse and the arterial blood oxygen, of course, the respiratory rate. So your baseline is 170 over 90. So I'm going to rerun the machine. So it states here that you have a 180 over 90 blood pressure rate, and your pulse rate is 90, which is quite low because the normal value of our pulse is, wait, 70 minutes 70 beats per minute rather, so it's quite high. And then your respiratory rate is 15 beats per minute, and it is very low. So I assuming, or there's no assuming with that, as it is an evidence that you are having a hypertensive stage, or upon checking on the physician's diagnosis, we may conclude that you are having a hypertension, or experiencing rather. So as I said, you have a 140 over 9. Your arterial or pulse oximeter is 90. So I'm going to save it. Save your form and submit it to the database. So I'm going to visit your notes as per the doctor's order. So your clinical note is on experiencing hypertensive episodes. So the primary diagnosis, or the primary diagnose, will be contacted by our physicians. So I'm going to endorse it. But then, primary. So the date today is June 6, 2021. So I'm going to admit you to the inpatient ward. So I am Chan Smith. My real name is Chan Smith. So do you have any allergies, Kia?
None.
So if there is any problem, so let's admit you to the inpatient department. Admitted by me, John Smith, my real name, inpatient ward.